It is Tuesday and time to check in with our doctor on call. As more hospitals are dealing with rising COVID-19 cases, doctors are sounding the alarm on another issue. Hospitals have reported a drop in heart attack and stroke patients. That doesn't mean people are not having heart attacks and strokes. Joining us now is Dr. Jonathan Hassell, a TriHealth cardiologist. Good afternoon, doctor. So where are these patients?
Good afternoon. Thank you for having me. We're not entirely sure where the patients are. We've seen a 40% drop across America and across the world, published in multiple papers. The concern is that people are staying at home through the heart attacks.
And so let me ask you this question. With people staying at home, it's less running around. You're not dealing with the stress of work, etc. Is it possible we're having fewer heart attacks and strokes? Are people more rested and relaxed? I mean, 40% is a huge drop.
Correct. It's almost an unbelievable drop. There is definitely several theories going around. There could be less total number of strokes and heart attacks, but 40% is more than we would expect, even with the decreased stress, because people are also very stressed out about the virus. There are some things that are increased stress.
Okay, so let me ask you this other question, because this has been in the news here recently. The issue of blood clots caused by COVID-19. The one actor had to have his leg removed because of a blood clot. Now concerned there could be heart issues. I understand in some states when people come in with COVID-19, they're automatically being given blood thinners. What do you think about that?
Yes, it is increasing inflammation in the body. When you increase the inflammation, you do have more clotting. We at TriHealth, and I think the national protocol, what most people are doing, we give blood thinners to people that are hospitalized anyway. They're giving higher doses and screening for blood clots. That actor, I don't have all the details of the case, but they did publish he was on a heart-lung machine and was quite ill, so he was kind of a unique situation.
Well, that's good to know, though. So sad for him and his family, and I understand he's still in the ICU. What do you want families to know when we have so many people potentially staying home dealing with heart attacks and strokes? Do you want to give a statement about the safety in coming to an ER if you need to?
Yes, people should absolutely come in if you're having a heart attack or stroke. If you stay at home through these, they can cause a lot of irreversible damage that we cannot fix later. If people are having the classic symptoms of heart attacks, chest pain or shortness of breath, please come to the hospital. And same with stroke, with slurred speech or facial droop, please come in. The hospitals are doing an excellent job. We're screening everyone coming in. No visitors are allowed. Everyone gets a mask. The COVID patients or suspected COVID patients are put in a separate area entirely. So we're doing our best to keep people safe. But it's important not to put off your other care at this time.
All right, doctor, I have time for one more question, and it gets a little personal. How is your staff doing? How are you doing? What is the level of stress right now when you talk about being properly protected there in a hospital situation?
I think we're doing pretty well. I think that TriHealth has been very organized in our approach. We're trying to keep our spirits up. Ohio was ahead of the curve a little bit in the restrictions, so our numbers have not been as high as they were originally expected to be, and I think we're managing pretty well. Even
with testing, this morning we were reporting that the number of confirmed cases in Ohio has risen sharply, but they think it's because more people have been tested. And they also now believe the death rate is way lower, like maybe less than 1%, because we're finding out so many people had it that didn't even know it. What do you make of this?
Yeah, we won't know all of those numbers until we get the antibody tests widely available and we can see who had it. But certainly many more people have had it than we are counting because just the limits in the testing, not everyone has been tested. We will see that number continue to go up. But we're doing our best to treat them and keep it so that the hospitals can handle the number of patients.
All right, Dr. Hassell, a cardiologist with TriHealth, we sure appreciate the hard work you do. You all now are the frontliners up there with our police officers and firefighters and taking risks, I think, in a lot of people's minds now, and we sure appreciate what you do.
Thank you very much. Thank you for having me.
Have a good afternoon. All right, let's turn to your forecast.